So now I want to talk briefly about chronic diseases in the West. First of all, they're not chronic diseases. They're names given to clusters of symptoms which people then claim to represent diseases, but they're not. They're clusters of outcomes, of processes which are going on under the surface, energetically, which end up as chronic. There's a set of chronic symptoms which slowly get worse. This applies to cancer, high blood pressure, diabetes, you name it. Any chronic disease is an outcome. It's not a chronic disease. It's a misnaming. So cancer, for example, is a huge amount to do with toxicity. And it's not to do with, it isn't a name, but the name itself has become toxic. And it's scary. And if you go to see an oncologist, you really need my friend who used to work at the Bristol Cancer Help Centre said that, you had to spend at least the first session detoxing the person from the medical diagnostic terms and the way that they've been treated and the fear that had been induced in them. So we've got a bit past that now, or at least some people have, and there are support groups and Facebook groups and all sorts of things for cancer. But the most important thing to remember with all chronic diseases is they're not really diseases. This is a misunderstanding and a misappropriation. With infectious diseases like malaria, there is a bug, there is a germ, a bacteria or virus, so to speak, with all the infectious diseases. And that is, once you know what the disease is, you have a pretty idea of the outcome, and there's a pretty good idea what to do about it. And the way I was involved in treating these diseases and developed is, in fact, just on the side, the most effective system ever invented as far as I can see. And I've never come across anything in the last 20 years which is better from the point of view of treating epidemic diseases. They really are the resonances for these epidemic diseases are the best thing out. And I don't like to brag, but it's not bragging, it's just to say that's my conclusion after watching all the other stuff and inaction and antiretroviral drugs and things. It's still the best.